So the most common medicines used right now on telemedicine for weight loss are these GLP-1 agonists. We talked about them before. They're extremely popular in the news. The glucagon-like peptide 1. These medicines work by mimicking this hormone from our intestines. One of the things it does is that it slows down our gastric emptying. There's certain possible receptors in the brain that may be attributed to nausea. I don't think all of the nausea is exactly from gastric emptying slowing down, but probably a good amount of it is. What's the most common thing that you see with these patients? Is it nausea?
Nausea, definitely. It's the thing that I get the most, pings on telemedicine for, and it's usually within the first 24, 48 hours if they're going to have it, which again, going back to telemedicine, at least we can manage it in real time, but by far nausea is the most common.
I'd say that most people will have some mild bit of nausea, but I'd say for most people, it's tolerable. Nothing, you don't need to intervene, maybe some guidance on how to eat, changes in diet. But what would you say? Because I always tell patients a certain number. I'd like to hear what you have to say. What is the number of patients that say, I need some medicine or something right now for this nausea? What would you say?
I feel like 20% will ask for a prescription level anti-nausea medication. That's just my observation with my patients. I'd say up to 30 to 40% will experience some kind of nausea in general that can be managed either with eating a little bit more often. I find that if people are going long periods of times without eating, on an empty stomach, that contributes to the nausea, in my opinion. But I always say, try ginger and ginger chews and gum and things like that over the counter. You can use those more often than the nausea medications. We really try to reserve that for severe nausea, vomiting, when you're really not able to tolerate anything